Most people believe that diabetes symptoms only show up after a blood test. You go to your doctor, they run your labs, and that's when you find out something is wrong. I understand why people think that. For years, that's exactly what many of my patients believe too. But after more than 2 decades of practicing medicine, I can tell you something that may surprise you.
The real high blood sugar symptoms don't begin in a lab. They begin quietly, sometimes years earlier, in ways most people don't recognize. My name is Dr. Daniel Reeves. I've been working in community clinics and senior care centers across the United States for over 25 years. And what I see, confirmed in my office every single week, is this. Your body starts warning you about rising blood sugar long before any test ever does. And the very first place those warning signs often appear is your feet. The reason I'm telling you this today is because of how many patients I've seen walk into my clinic, completely unaware that their body has already been sending them signals. Signals they noticed, but didn't understand. Signals they explained away. Just a few weeks ago, I met a patient who reminded me exactly why this matters. His name was George Walker, 70 years old. Retired truck driver, he lived a simple, steady life. Spent his mornings watching the news, his afternoons running small errands, and his evenings with his wife in front of the television. He didn't come in because he felt sick. He came in for something routine. But before we got to anything else, I asked him a simple question. How have your feet been feeling lately? He looked at me and said, well, they felt a little strange. Nothing serious, probably just age. I hear that answer all the time, and on the surface it sounds harmless. But after years of seeing the same pattern, I've learned to pay very close attention when someone says that, because a little strange is often where the story begins. As he sat there, I noticed a few things. His shoes were worn unevenly. His steps were slightly slower than he realized. And when he shifted his weight, there was just a small hesitation. Nothing dramatic, nothing alarming. The kind of things most people would never think twice about. But I've seen enough patients to know. Those small details matter. So before we moved on, I decided to take a closer look. I examined his feet carefully. The skin, the circulation, the response to touch. Again, nothing severe, but enough to make me pause. So I ordered a simple test, a fasting blood sugar test. When the results came back, his blood sugar was over 200. George wasn't just experiencing high blood sugar symptoms, he had been living with them, silently, for years. And he had no idea. He looked at me and said something I will never forget. But I feel fine. And that's exactly the problem. Because diabetes doesn't always make you feel sick at first. It works quietly. It affects your nerves, your circulation, your ability to heal, all before you realize something is wrong. George didn't come in because he was sick. He came in because his body had already been warning him, and like so many people, he almost missed it. He didn't come in because he was sick. He came in because his body had been warning him, and he almost missed it. Before we go any further, let me ask you to do one thing. If stories like this make you stop and think about aging, about independence, about what really matters, take a second to like this video and subscribe. This channel shares stories that don't sugarcoat getting older. And today's story might change how you see it entirely. Because what I'm about to show you isn't theory. It's what I see in my clinic every single week. Patients who thought nothing was wrong until their body had already been warning them for years. Now, let's continue the story. Because what I saw on George's feet that day wasn't just one issue. It was a pattern. A pattern I've seen repeat itself for years in patients who believed nothing was wrong until the damage had already begun. There are 9 signs I look for, long before any blood test confirms diabetes. And the first ones are the easiest to miss. Not because they're rare, but because they feel normal. This is where most diabetes symptoms begin. Quiet, subtle, easy to explain away. And this is exactly the kind of senior health advice I wish more people understood earlier. Sign number 1, is swelling in the feet and ankles. Almost every patient tells me the same thing at first. I've been on my feet all day. It's just part of getting older, and sometimes that's true. But when swelling becomes consistent, when your socks leave deep marks, when your shoes feel tighter in the evening than they did in the morning, that's when I start to look deeper. Because one of the early high blood sugar symptoms doesn't feel like blood sugar at all. It shows up as fluid. Here's what's actually happening. Your kidneys are responsible for filtering fluid in your body. When blood sugar stays elevated over time, those filters begin to lose efficiency. Fluid doesn't move the way it should. It starts to collect, and gravity pulls it downward, right into your feet and ankles. I often explain it this way. Imagine your body as a filtration system. When the filters slow down, everything backs up. That swelling you see isn't just discomfort. It's pressure building in a system that's no longer working at full capacity. The solution isn't complicated, but it is important. Elevate your feet when you sit. Reduce sodium in your diet. These are simple habits, but they support a system that may already be under strain from rising blood sugar. Now, sign number 2 is something many people joke about, until it becomes constant. Cold feet. I hear it all the time. Doctor, I've always had cold feet. But then I ask a different question. Are they cold in the summer? Are they cold even under blankets? That's when the answer changes. Because when your feet stay cold regardless of the temperature around you, that's not comfort. That's circulation. And circulation is one of the first systems affected when diabetes symptoms begin to develop. High blood sugar damages blood vessels slowly. They become narrower, less flexible. So even though your heart is still pumping, the blood isn't reaching the farthest parts of your body the way it should. Your feet are the last stop in that journey. Think of it like a highway system. When the traffic slows down, the farthest towns receive less supply. Your feet are those towns. And when they don't receive enough warm, oxygen-rich blood, they stay cold, even when the rest of your body feels fine. This is one of the most overlooked signs of high blood sugar, especially in older adults. And yet, it's one of the clearest signals your circulation is under stress. The most effective response is movement. A brisk daily walk, not a slow stroll, but intentional movement, forces blood back into those smaller vessels. Over time, that improves flow and supports your overall vascular health. Now, the third sign is the one almost nobody notices on their own: loss of hair on the feet and lower legs. In fact, I usually have to point it out. A patient will look down and say, "I never even noticed that." And that's exactly the problem. Because this is one of the quietest early signs of diabetes. There's no pain, no discomfort, just absence. Hair follicles depend on a steady supply of blood and oxygen. When circulation is reduced, not suddenly but gradually over time, those follicles stop receiving what they need, and little by little, they stop producing hair. This doesn't happen overnight. It's a slow process, which is why it often signals something deeper, what we call hidden diabetes, where the body has been under pressure for years before a diagnosis is ever made. And this is where experience matters. Because when I see this sign, I don't think about today. I think about what's been happening inside the body for a long time. All 3 of these signs, swelling, cold feet, and loss of hair, have something in common. They don't interrupt your day. They don't cause immediate concern. They don't feel urgent, and that's exactly why they're so dangerous. These early signs don't hurt. And that's exactly why they're so dangerous. And what happens next is something I want you to pay very close attention to, because this is the stage where those quiet diabetes symptoms begin to change. They don't stay silent forever. At some point, the body stops whispering and starts showing you something you can see, something you can feel, something that begins to interfere with your daily life. And that's where most of my patients start to realize something isn't right. The 4th sign is something many people notice, but almost never connect to high blood sugar symptoms: changes in skin color. I've had patients sit in front of me and say, "Doctor, my ankles just look darker lately. I thought it was sun damage. I figured it was just aging skin." And sometimes, that's exactly what it is. But there's a very specific pattern I look for, a deepening color around the ankles, a reddish tone, sometimes even a bluish tint. And when I see that, I start thinking about circulation. Because when blood sugar remains elevated, it begins to affect your blood vessels. They narrow, they stiffen, and over time, they can't deliver oxygen-rich blood the way they used to. I explain it to my patients like this. Think of your bloodstream as a delivery system. Every second, it's transporting oxygen and nutrients to every part of your body. Your feet are at the very end of that delivery route. So when something goes wrong, when those vessels narrow, your feet are the first place that starts to show it. Like delivery trucks no longer reaching their destination. The skin changes color because it's not getting what it needs. That's not just cosmetic. That's a visible signal that blood flow is being compromised. This is one of the most overlooked diabetes symptoms in feet, and it often appears long before a diagnosis is made. The best response here is simple movement. Even 5 minutes in the morning, ankle rotations, toe raises, light walking, can help push blood back into those areas. Small movements, but they restart the delivery system. Now, the fifth sign is one that almost everyone has experienced at some point in their life. Cracked heels. And this is where things get misleading, because nearly every patient tells me the same thing. It's just dry skin. And sometimes it is. But when those cracks become deeper, when they don't improve no matter how much lotion you use, when they show up even in warm weather, that's when we're dealing with something different. Because this isn't just about skin anymore. This is about nerves. More specifically, the autonomic nerves. The ones responsible for controlling moisture and sweat in your body. When high blood sugar symptoms begin affecting those nerves, the sweat glands in your feet stop working properly. Your skin loses moisture from the inside out. And no matter how much lotion you apply on the outside, it doesn't fix the root problem. I often explain it this way. Your skin is like a wall, and those nerves are what keep the structure sealed. When the system fails, the surface begins to break down, cracks appear, and those cracks are more than just uncomfortable. They're openings. Openings for bacteria, openings for infection, and in a body where circulation is already compromised, that infection can escalate quickly. This is why, in my practice, persistent heel cracking is never something I ignore. It's one of those warning signs of diabetes that tells me the nervous system is already under stress. The solution here is twofold. Moisturize your feet daily, especially at night. And just as important, hydrate your body. Because your skin doesn't just need moisture from the outside, it needs it from within. Now, the sixth sign is the one patients describe as the most uncomfortable and often the most confusing. Burning in the feet at night. I've had patients tell me, it feels like my feet are on fire. Only when I lie down, I can't sleep because of it. And what makes this so frustrating is that there's nothing visible causing it. No heat source, no injury. But the sensation is very real. This is what happens when nerve damage begins to progress. The nerves in your feet, already affected by elevated blood sugar, start sending incorrect signals to your brain. Your brain receives a message of heat, even though there is no heat. The system is misfiring. Think of it like a fire alarm with a damaged sensor. There's no fire, but the alarm keeps going off. That's exactly what's happening inside your body. And this is one of the clearest type 2 diabetes symptoms that the nervous system is being affected. The approach here focuses on supporting your system from the inside. Hydration plays a major role. So does diet, especially increasing fiber intake, because stabilizing blood sugar helps reduce the stress on those nerves, and over time, that can reduce the intensity of those signals. And this is the moment I want you to recognize, because by the time you reach this stage, your body isn't just sending quiet signals anymore. It's affecting how you feel, how you move, even how you sleep. At this stage, your body isn't just whispering anymore. It's starting to interrupt your life. And if it continues, if those signals are still ignored, this is where things take a more serious turn. Because now, we're no longer talking about subtle diabetes symptoms. We're talking about damage that you can feel, sharply, suddenly. and sometimes severely. The seventh sign is pain, not just discomfort, not soreness after a long day. I'm talking about sharp, sudden pain in the feet, something patients often describe as electric, stabbing, or like a hot needle shooting through the skin. And almost every time, I hear the same explanation. "Doctor, it's probably arthritis. Maybe an old injury acting up." That's a very common assumption, but in many cases, it's not the joints at all. It's the nerves. When high blood sugar symptoms persist over time, nerves don't always go numb right away. Sometimes they do the opposite. They become overactive. Instead of going quiet, they begin firing random, intense signals to the brain, signals that don't match what's actually happening in the body. I explain it like this. Imagine a car alarm that's been damaged. No one is touching the car, nothing is wrong. But suddenly, the alarm goes off. Loud, sharp, unpredictable. That's what damaged nerves do. They send signals of pain, even when there's no physical injury. And this is one of the most commonly misunderstood type 2 diabetes symptoms, because people treat the pain, but not the cause. Taking pain relievers may dull the sensation, but it doesn't fix the signal. It doesn't repair the nerve. The approach here is simple, but important. Gentle daily stretching, foot and ankle movement before you stand up in the morning, light massage before bed. These habits improve circulation and reduce nerve stress. They don't eliminate the condition overnight, but they support the system that's under pressure. Now, the eighth sign is one you've probably heard before, but may not have taken seriously. Tingling, numbness, that pins and needles feeling. Most people dismiss it immediately. My foot just fell asleep. I was sitting too long. And yes, that happens, but when it happens frequently, when it shows up without a clear reason, that's when it becomes one of the clearest early warning signs of diabetes, because this is how nerve damage often begins. Gradually, quietly. I tell my patients to think of their nerves like electrical wires. Each wire has a protective coating around it. That coating allows signals to travel clearly from your brain to your body. But when blood sugar remains high, it slowly damages that outer layer. Almost like corrosion, the wire still works, for a while. But the signals become distorted, weaker, less precise. And that distortion, that's the tingling you feel. That's the numbness. This is one of the earliest and most common diabetes symptoms in feet, and it's often the first sign that the nervous system is under stress. The best response is movement and control. Regular walking to improve blood flow, reducing added sugar to stabilize the system, because the longer those nerves stay exposed to high glucose, the more damage accumulates. Now we come to the ninth sign, and this is the one I take most seriously, because this is where everything we've talked about, circulation, nerves, healing, comes together. Wounds that don't heal. I've had patients come in and say, "It's just a small cut, a blister from my shoe." And then they tell me it's been there for 2 weeks, 3 weeks, sometimes longer. Let me tell you about a patient I saw in Florida. He had a small scrape on his foot, something minor. He didn't think much of it. He cleaned it once, maybe twice. Then he left it alone. When he finally came in, that small wound had become infected, and the reason was simple. His body couldn't heal it. Because one of the most dangerous high blood sugar symptoms is the body's reduced ability to repair itself. When blood sugar stays elevated, blood vessels narrow, circulation slows, and the cells responsible for healing, oxygen, nutrients, immune cells, they can't reach the wound in time. I explain it this way. Imagine trying to water a garden, but the hose is bent. The water exists, but it can't reach where it needs to go. That's what's happening inside the body, and an open wound without proper healing becomes an infection waiting to happen. This is why diabetic foot ulcers are one of the leading causes of amputation in the United States. And almost every case starts the same way. A small wound that was ignored. The action here is immediate and non-negotiable. Check your feet every day, every day. Look for cuts, blisters, cracks. If something doesn't improve within 48 hours, you don't wait. You call your doctor, because at this stage, time matters. And early action can make the difference between recovery and something much more serious. And this is the point I want you to remember. Because everything we've talked about leads here. This is where ignoring the signs stops being harmless and starts becoming dangerous. So the question becomes, what do you do now? Because everything I've just shown you, the diabetes symptoms, the high blood sugar symptoms, the changes in your nerves, your circulation, your skin, none of that matters if it doesn't lead to action. And the truth is, the most important step you can take doesn't require a prescription. It doesn't require a specialist. It doesn't even require leaving your home. Tonight, before you go to bed, I want you to sit down, not rush, not think about it later. Sit down and take a close look at your feet. Start with the skin. Look for any change in color, any darkening, any redness that wasn't there before. Then look between your toes. This is where many diabetes symptoms in feet first appear. Hidden areas people almost never check. Look for moisture, cracks, signs of irritation. Then check for any wound, even something small, a cut, a blister, a spot that doesn't look right. Don't assume it will heal. At this stage, with high blood sugar symptoms, healing is not guaranteed. And finally, pay attention to how your feet feel. Do you notice numbness, tingling, a delayed response when you touch your skin? These are not random sensations. These are signals that your nervous system may already be under stress. Now here's what I want you to understand. This entire process takes about 30 seconds. That's it. 30 seconds that could tell you more about your health than you realize. 30 seconds that could help you catch something early, before it progresses into something serious. Because when it comes to conditions like type 2 diabetes symptoms, timing matters. The earlier you recognize the signs, the more control you have over your nerves, over your circulation, over your long-term health. This is the kind of senior health advice I give every patient I see. Not because it's complicated, but because it works. And here's the most important part. If you notice anything at all from what we've talked about, don't wait. Don't monitor it for weeks. Don't try to convince yourself it will go away. Call your doctor tomorrow. Not next week, tomorrow. Because early action changes outcomes. It's the difference between managing a condition and reacting to a crisis. And after everything I've seen over the last 25 years, I can tell you with complete certainty, the patients who act early are the ones who keep their independence. And I want you to hold on to that, because what I'm about to say is the hardest part of this entire conversation. After 25 years of treating patients, one of the most difficult moments I face is sitting across from someone who has had these diabetes symptoms for years and is only just now discovering what they mean. Not days, not weeks, years, 2, sometimes 3 years of high blood sugar symptoms, tingling, swelling, changes in skin, wounds that didn't heal. And they never realized what their body was trying to tell them. Not because they didn't care, not because they ignored their health. They didn't ignore their health, they just didn't recognize the signs. And that's what makes this so important. Because diabetes doesn't announce itself loudly at the beginning. It works quietly. It slowly affects your nerves, changing how you feel the ground beneath your feet. It affects your kidneys, altering how your body manages fluid. It affects your circulation, reducing the blood flow your tissues depend on. It affects your vision, often before you even notice the change. And over time, it affects something even more important, your ability to move, your ability to walk confidently, to stand without hesitation, to trust your own balance. This is what long-term type 2 diabetes symptoms can take from you, slowly, quietly, and without warning if you're not paying attention. And that's why this matters so much, because for most people watching this isn't just about health, it's about independence. You worked your entire life for your independence. You worked to be able to drive where you want, to go out when you choose, to live without needing help for the simplest things. That freedom, That ability to take care of yourself is something you built over decades, and it's something worth protecting. Because here's the truth. Don't let something as manageable as blood sugar take that away from you. This isn't about fear. It's about awareness. Because when you understand the early signs of diabetes, when you recognize the warning signs of diabetes, you give yourself a chance to act early, to make small changes that lead to real outcomes, to protect your nerves, to support your circulation, to prevent the kind of complications that change lives. This is the kind of senior health advice that doesn't just add years, it protects the quality of those years. And that brings me to the one thing I want you to remember when this video ends. Not the statistics, not the medical terms, just this. Your body is already speaking. The only question is, are you listening? If this story resonated with you, please like this video, subscribe, and share it with someone who might need to hear it. Your spouse, a parent, a friend, so the people around you can avoid the silent dangers that threaten independence in later years. Leave a comment below. What signs have you been overlooking? I'd love to read your thoughts. Because next time, I'll be sharing something most people never talk about. Chew this before bed. Watch your memory come back strong in just 10 days. Thank you for watching. And remember, your best years aren't behind you.